Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Good. Thanks for having me.
Absolutely. I'm excited for us to link up. I'm excited that Andrew from Vituity connected us. He's been a great connector of future guests. So I'm excited that we're able to have this opportunity to speak and for our audience to learn more about you. I think we should dive right into it.
Let's do it.
I'd love if you could tell the audience a little bit about your background.
Yeah. So my name is Nirav Shah, founder of Alertive. We make remote monitoring software specifically for chronic and higher acuity patients. I'm a stroke neurologist by training. I trained all over the US, went to med school at IU in Indiana, Miami for residency, UCSF for fellowship. And then I moved to Seattle where I became stroke director of a healthcare system called Swedish, which is owned by Providence. And then I left practice almost 2 years ago, specifically to start working on remote monitoring full time. And the reason why I left is that in my system of care, where we took care of 2,000 patients with a stroke every year, trying to get them back into the clinic to monitor and manage their blood pressure was a nightmare. Our wait times were getting longer. There was just no way to get these people back. We couldn't coordinate this care across cardiology or primary care or endocrinology. And so it seemed like a very solvable problem. And so I set out to start building remote monitoring for my patients with Medicare, patients who had access to care, who were on meds, and a really different user base than, let's say, what Livongo serves, which is 51-year-olds who are Home Depot or Delta employees. And so at the time, it seemed a little bit, contrarian. People didn't think stroke patients would be able to use an app. Ultimately, we started working with stroke patients and cardiac patients and kidney patients. And, it turns out they will. If they have the right provider connectivity and they're showing up to healthcare, they're pretty engaged. And so that's how we got off to the races. By luck or timing, Medicare started reimbursing for remote patient monitoring in late 2018, and then set out new reimbursements in 2019 and then more in 2021. And so it's just been the perfect time to start working on this. We've been fortunate to have great investors and a great team who's really working on this with me.
Very interesting. Yeah, we were laughing in our kind of intro call the other day about your CTO. I've spoken with him in the past, and he has a background that comes from Imprivata, which obviously big company in the health tech space. Yeah, you have a great team, and I love both the brand, your website, the area that you guys are in within healthcare, and I'm excited that we have this opportunity to speak. Can you talk a little bit about you gave us a good highlight, an overview, but like what platform you offer, what product you offer to your customers?
Sure. So our customers are healthcare organizations. That basically means hospitals and clinics that have doctors, nurses, PAs, and NPs. And our goal is to help them provide care anytime, anywhere. And so our byline is we want to make healthcare within reach. And that's kind of my co-founder Jorge's sort of slogan that he came up with. And I think it's a really good one. And so what we do for the providers is give them the technology, software, the access to mobile app for their patients or an SMS-based platform to connect patients to remote monitoring hardware, whether it's a blood pressure cuff or an ECG or a glucose monitor that's either Bluetooth or cellular, and connect that data to the cloud and then curate that data so that the providers don't get bothered with alerts. So as many people might know, this notion of alert fatigue with EHRs is pretty common as a buzzword. And so we decided to lean into it, right? Because the goal is not to alert people just for the sake of alerting them. There should be something that one does. And so when I was in practice, and a lot of ED docs like Andy Smith and the team at Vituity know this really well, getting pinged about someone with a palpitation in the middle of the night from a cardiac monitor is very frustrating because there's nothing to do about it. So you have the liability as a provider, which is fair because that's what you're doing work for, but you also need to be protected. You need to get sleep and rest so you don't burn out. And so in my experience when I was at Swedish and we're trying to think of how to drive cardiac monitoring for post-acute stroke patients at risk of AFib in our system, we couldn't because everybody's just worried about who's going to have to deal with this data. And so ultimately, we realized that companies like Medtronic and iRhythm were kind of helping providers outsource this to service lines that will basically be third-party data monitoring services. And so we built that. And so in a nutshell, we try to be everything a provider needs, start to finish, from hardware, software, technology, broker, provider, and manager, as well as billing, which is a key kind of differentiator to drive remote care home.
And how long has it been since you started the company? Can you share more details, I guess, regarding I guess what I'd like to know too is, when did you know you wanted to start Alertive?
Yeah, that's a good question. 2015 is when we first had the idea. I was still in fellowship. It was on the heels of a really important clinical paper called Sprint. Sprint was an international paper about hypertension. And then in Miami, I trained with a group of stroke neurologists who were responsible for the Northern Manhattan study, which is a big epidemiology study based in New York. And basically what I knew from some of that work was that we were really bad at managing epidemiologic risk factors, things like blood pressure, diet, lifestyle, for not only primary prevention of stroke, but also the secondary prevention. And so now, I told my chair at the time then that I'd like to go to SF and learn about technology. Prior to all this in college, I worked on brain computer interfaces. So I really truly believe that the right technology can scale healthcare, and clearly there aren't enough providers, whether it's doctors, nurses, or any of the other types of providers. And so sitting at UCSF thinking about wearables, I was working this AFib project that is essentially what Apple successfully did well before we did. It seemed to me that we're going to be really behind based on this new, really landmark study, Sprint, and like remote Bluetooth blood pressure was going to be the way to solve it. And so that's really where we had the idea, because it seemed like such a solvable, low-hanging fruit that just no one was interested in. And then while I was at Swedish, I had the lens of insurance plans. I could call them and say, look, why would you just pay for this? And no one was interested. And so I was trying to think of the payment model to, reimburse for the solution that I really cared about. And finally, when Medicare paid for it, it just became really straightforward. Because by that point, I'd already piloted, I'd done a few studies, one in a skilled nursing facility for readmission reduction with Jorge, and then another across a few hundred patients. And so those are the kind of proof points we needed as we kind of unwrapped the onion, right? But layer by layer, de-risking each part of the concept.
What are some of the things that I guess you're most excited about as we head into 2021? Crazy year last year, right? With the pandemic. We're still not out of the woods, but in terms of your business, what are you most excited for as we kickstart this year?
Yeah, no, that's a great question. So for me, what I think is going to be increasingly exciting is sort of the privilege and opportunity we got last year. So we got to do contact tracing for a number of systems. We did all the contact tracing in Q2 and 3 for Dell Medical and Austin. We did COVID monitoring for independent living and nursing homes in Seattle area. And that early brand building that we did, initially at the time, could have seemed like a pivot, but we felt like we had to do something reasonable in space. We had an architecture that was designed to do contact tracing on day one. And so that taught us a lot and gave us a lot of insights from where we thought healthcare would go. Late last year, and we were just talking about this a little bit, Medicare announced Hospital Without Walls. I think for us, what we're pretty excited about is real-time, home-based, hospital-based care, because that's where we think the world's going. We think healthcare is going to shift home with, hospitals in general struggle to stay full in the right way, right? Some of the patients that we don't want in the hospital, in my case, those are TIA patients, low-risk stroke patients that shouldn't be admitted because they cost money and they're exposed to all these risks of other infections. Right now, that infection risk is COVID. I think we can get those patients home. And that's part of why, a group like Vituity is not only invested, but partnered with us on these types of endeavors. If we could protect the emergency department, help those ED docs send patients home that don't need to be in the hospital, that helps reduce their liability, provides better care, and it'll be better margins for the system. And so this is what people, in general refer to the triple aim. It's just very hard to find those three things in the same bucket.
And you and I have talked about, this is really your intro podcast of having you come on and share a little bit about Alertive and give us that quick snapshot of the company, right, and yourself. But we want to have you come on several occasions to talk about more specific topics like you just broke down in greater detail, acquisitions, and some other topics as well. So we're excited for that opportunity. And this is a great kind of welcome to Slice of Healthcare, and welcome to our audience, so they get to know you a little bit. Where can they learn more about Alertive if they want to go investigate on their own?
Yeah, thanks, Jared. So they can go to alertive.com, alertive.com. So it's alert plus live, all one word, jammed together.com. And you can always email me, nirav@alertive.com.
Perfect. And I'll throw some links into the show notes so the audience will be able to easily find your site and more. And yeah, look forward to continuing the conversation and working together on some other things. But thanks again for joining me on the Slice of Healthcare podcast.
Yeah, happy to be here. We'll do this again, hopefully often.
Thanks.